This is Jerry Hesch, an orthopedic manual physical therapist from Hesch Institute in Aurora, Colorado. And my website is heschinstitute.com. It's spelled H-E-S-C-H Institute. And my client is an orthopedic surgeon who has had 2 spinal surgeries, and he is fused at L3, L4, and at L4, L5, and he has a very good disc space at L5, S1. And he's having some symptoms in the region of the SI joint, and he came to see me to have his sacroiliac joint evaluated and treated. On a separate film, he had a pattern called left lower windswept pelvis, and we treated that, and that's now normal. And basically, he has normal mobility in all directions throughout his pelvis. Springing the ischial tuberosities medial, springing them laterally, mobility is good. Springing ilium inferiorly is good. And springing the ilium into forward rotation is good mobility. He has good inferior glide mobility of his sacrum. I see his heels bob, so the force translates through the certainly through the L5, S1 facets, but also through the SI into the hips and down into the lower extremities. He also has backward bending mobility of the sacrum, but what he lacks, this is his PSIS, so S1 would be right here because S2 is at the level of the PSISs. So we're on S1, sacral base, and there's no mobility. I cannot take up the slack, and if I double that force using a reasonable amount of pressure, there's no mobility at all. So if I come up ½ an inch, I should be on L5, and I asked him before, and he could feel me taking up the slack, and he could feel this spring mobility. It feels a little hypo, so maybe that'll improve when we improve the sacral mobility. And then if I come up another ½ inch, now I've got to be on the fused L5 segment. L4 segment. That's not moving at all. And then I'm ½ an inch above that, and I must be at about L3. There's no give there at all. And then I come up another ½ inch, and now I can take it the slack and spring it. So I'm assuming that I'm now at L2. Okay? So the treatment for this is really straightforward, and it should be a one-time treatment. And all I'm going to do is push on the sacral base for 3 minutes while I have him prone up on his elbows. So he's going to come up on his elbows, and I'm going to apply anterior pressure. If I were to measure this on a bathroom scale, it's about 10 pounds. And I'm going to apply that for 3 minutes. And then I'll have him do extension exercises daily. I'll have him back up to a piece of furniture, a table or something that hits him below the buttock, hits him against the posterior thigh, and then he just does gentle backward bending, and I'll recommend 30 of those a day. Just very gentle, very slow to reinforce that motion coupling. So I'll stop filming now. I'll lean on that for 3 minutes, and then I will show you the response. So let me change my camera angle and then show you the extension exercise. So his home program will be once a day to back up to a piece of furniture where it hits below the gluteal crease, and he just arches backward very gently, just brings his shoulders back very slowly and very gently, doing 30 of those.